A discussion has ensued over the past several decades regarding the nature of counseling. Specifically, the question has been raised of whether clinical human services should be delivered in a universal manner, assuming that all counseling is multicultural, or whether acknowledging the differences inherent in working with members of diverse groups, clinical efforts should be culturally focused and specifically relevant to the population receiving services. An etic or cultural general perspective is one in which a researcher objectively observes the subject of research without actively participating in the research. On the other hand, an emic, culture-specific perspective, research data is gathered from within the subject's perspective and experience. As a result, conclusions drawn at the end of the research reflect either a determination about the subject's experience or an empathic appreciation of subjective experience. When considered with the influence of culture, an ongoing debate poses the question of whether cross-cultural counseling should be or must be culture-specific, or whether counseling is counseling and Eurocentric theories can be applied universally. Peterson wrote, "The basic problem facing counselors is how to describe behavior in terms that are true to a particular culture, while at the same time comparing those behaviors with a similar pattern in one or more other cultures." Sue and Sue frame the discussion of emic versus etic view as cultural universality versus cultural relativism. They describe the interaction between a professor and a student, in which the professor's orientation is etic. He believes good counseling is good counseling, and any presenting mental health problems, for instance, depression or schizophrenia, are evident in all cultures. Therefore, it is only minimally necessary to modify treatment practices and objectives to help achieve a state of normal functioning for a client. The student, on the other hand, points out the importance and relevance of evaluating the impact of cultural values, of how unique lifestyle and worldview might influence the expression and determination of deviant behavior. The assumption of universality held by the professor represents a major challenge to the helping professions. Professionals who support individual culture and life experiences in evaluating the expression of deviant behavior stress that current guidelines are ethnocentric in adhering to theories and practices based on work primarily with Euro-Americans and absent consideration of the influence of culture to modify determination of normal or abnormal. Peterson goes on to admonish counselors to avoid cultural encapsulation by examining their own culture-specific assumptions. He notes that professionals who acknowledge the importance of considering culture and life experiences in evaluating deviance point out that current guidelines and standards of ethical practice are culture-bound and often inappropriate for racial ethnic minority groups. The discussion can continue by considering two questions that have been posed. One, what is universal in human behavior that is also relevant to counseling and therapy? And two, what is the relationship between cultural norms, values, and attitudes on the one hand, and the manifestation of behavior disorders and their treatments on the other? It's important to keep in mind the observation that has been made by Sue and Sue, that in failing to acknowledge the devastating results of viewing diversity and difference as deviance, as human service professionals, we risk colluding with systems of oppression.